to Dr. Kanus, and I suppose that I'm referring my question to you because you are almost the top person who should be representing the government of the United States as it relates to this public health emergency. Basically, you gave us information that the CDC was aware of this problem since March, and that the CDC had mobilized resources to Africa, to the places where this problem had started, and that it developed over a couple of months. You are pretty aware of the fact that the international community has actually been condemning the international response to this problem, and there are those who believe that if those who really have the resources, like America, Europe, and some of the other rich countries, had actually done enough, fast enough, the mortality that we have will not be there. What would you say in terms of what you present as a response from your agency, which maybe by your estimation it was adequate, and the complaints from the international community?
And so it's always difficult to mobilize resources in a timely fashion, and the international community now is really moving very quickly to mobilize resources. At the time and in the area where the outbreak has really taken off and spread, it appears that there was a perfect storm in terms of having a very easily mobile community, and a community that was resistant to the outbreak control measures that have been used. And the efforts that were made at the time really for previous outbreaks should have been adequate, but I believe that the circumstances were such that it was able to move beyond what the resources that were put into play initially were there, and so that's why we have the situation that we're presented with now.
So while Jim's moving to the next one, do you think it's an issue that the virus may be a little different?
I think it may be a combination of several different factors. We certainly are interested in the question about whether there's any difference in the virus in terms of its behavior. However, from the basic standpoints of the kind of public health measures that we have used in over 20 Ebola and Marburg outbreaks in the past, those measures still need to be put fully into effect. And so we know the measures in terms of having adequate infection control, good burial practices, those are time-tested things, and we know that they're not currently adequate for the number of Ebola patients that are out there. And so that really is very essential to put those into play and to think about additional measures that we can take that can really be enacted rapidly.